The FDA has authorized a booster dose for Pfizer's COVID-19 vaccine for people 65 and older, as well as people with high risk of severe disease. And this is coming as the country sees the rate of new cases slowing at this point in time. Deaths, though, have hit over 2,000 a day. That is the highest in 6 months. And the pace of vaccinations is the slowest that it's been in 2 months. Former FDA Commissioner Dr. Scott Gottlieb is with us now. His new book is called Uncontrolled Spread: Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic. Doctor, thank you so much for being with us.
Thanks a lot.
So I want to ask you, because you see these numbers, these two numbers going in really the wrong direction. Vaccines trending down after an uptick, deaths at 2,000 people every day. And there is a vaccine that can largely prevent those deaths. How do you feel watching that as a doctor?
Well, look, it's tragic. This is now an avoidable death, certainly. And if we can get more people vaccinated, we can start to bring down these numbers. I wouldn't take too much solace in the fact that the case numbers are declining either. We see the case numbers declining across the country, but that's really driven by the fact that cases are collapsing in the South, where they had a very dense Delta wave of infection. The other parts of the country still are in store for Delta to sweep through different regions. We're seeing it in the Midwest right now in states like Kentucky and Indiana, Ohio. The Pacific Northwest has a pretty dense wave of Delta spreading through those states. And I don't think the Northeast is impervious either. There's a perception that because of our higher vaccination rates here in the Northeast, and I'm here in the Northeast today, and also the fact that we have a lot of immunity from prior infection, that was somewhat impervious to a Delta wave in this part of the country, I don't think that's necessarily the case. I think we're going to see infections start to pick up here as well as kids go back to school. Schools become sources of community transmission and people start to go back to work and the weather gets cold.
I know you talk to experts around the world. I wonder if you're, say, talking to a doctor in New Zealand or in England, where the vaccination rates are so high, and they're looking at what's going on in the U.S., and they think it's nuts. What do you say?
Yeah, look, we have a lot of difficulty in this country getting people vaccinated, and there's a lot of heterogeneity as you move across the country. The overall rate of vaccination of adults over the age of 18 is about 77% right now, which is pretty good. We've been building that over the course of the last 6-7 months. The Biden administration has been pushing out the vaccine, doing a pretty good job getting people vaccinated, but it's not enough. We really need to get to around 80 to 85% to have enough vaccination in the population that you start to see case rates decline and the velocity of spread start to slow. We have a lot of immunity in the population from prior infection. That does count. People who've been previously infected with the virus do have some immunity from a continued infection, but we don't know how long that immunity is going to last. So eventually people who've been infected, who are relying on natural immunity, they too are going to need to get vaccinated at some point. So we do need to get these vaccination rates up higher if we want to create a backstop against the kind of spread that we've seen this past summer.
What does winter look like? What do you think winter looks like here in the U.S.?
Yeah, I think this Delta wave may be the last major wave of infection, assuming nothing unexpected happens. We don't get a variant that pierces the immunity offered by prior infection by vaccination. So assuming that doesn't happen, and I think it's unlikely, this will be the last major wave of infection. This becomes a more persistent endemic risk. So you continue to have coronavirus spread, but not at the same rates we're seeing right now. And it settles into a pattern, more of a seasonal pattern, and basically becomes a second flu, probably more pathogenic than the flu, but something on par with the flu. The challenge is that we already have a flu. And if we have COVID circulating alongside flu, the cumulative death and disease caused by those two pathogens is going to be too much for society to bear. So we're going to have to do things differently in the wintertime to try to cut down on the risk of the spread of respiratory pathogens in places like work and schools. That means improving air quality in indoor spaces, improving air filtration, trying to de-densify offices, putting in place hand washing stations, encouraging the use of hand washing stations, probably wearing masks voluntarily in public spaces during peak COVID and flu season. I think you're going to see masks become much more culturally acceptable and used in parts of the country. So there's a lot of things we're probably going to be doing differently to cut down the risk of the spread of these respiratory pathogens once we get past this COVID epidemic and it becomes a more endemic risk.
You said yesterday that we're heading in a direction where masks will become optional. You know, can you be clear on that, about where we are now on masks indoors? You know, we're looking at schools, for instance, and when you think we're heading to a place where masks are optional?
Yeah, look, I think we need to base this on prevalence. Once the prevalence starts to decline, I think a lot of the steps that we've been taking become more routine and fade into the background, become more optional. People will wear masks when prevalence is high, and they'll take them off when prevalence declines. Right now, in many parts of the country, prevalence is still very high. If you look at the South during the peak of their epidemic in this summer, states like Florida, Mississippi, Alabama had about 110 cases per 100,000 people per day, new cases diagnosed. That's exceptionally high. New York City in the summertime, when they had their mini Delta wave, they had about 20 cases per 100,000 people per day. That's probably the level we're going to see on the back end of this Delta wave. I don't think that we're going to get down to levels where it's about 2 to 4 cases per 100,000 people per day, which is what we had in June and July. When we really hit the nadir. I think we're still going to have a lot of cases this winter just because it's the winter time and this is a winter pathogen. It likes to spread in the cold weather. But I think when we're getting down to about 20 cases per 100,000 people per day, that's when you're going to start to lift some of these mandates. And that's when I think masks are going to become something that's optional. People will wear them if they feel at risk. They want to protect themselves or their families. But I don't think that you'll be mandating the use of masks. But we're a long way from that. We've got to get through another surge of infection around the country. And you're seeing parts of the country get engulfed right now. This isn't over. Just because the South is coming down and the national average looks like it's falling, this has been a highly regionalized epidemic, and it's likely to continue to be so.
When do you think masks will be optional in schools?
Yeah, I think we're going to have to get to a point where the vaccines are widely available in schools. Schools aren't inherently safe environments, but they can be made more safe by taking proper precautions. Masks are certainly one tool. Also using testing. The data shows that if you implement twice a week routine testing, asymptomatic testing of students, you can cut down on the risk of transmission in the schools dramatically. And also keeping students in defined social pods. So not letting students intermingle, but keeping them within their class, for example, and having them move around the schoolhouse within their class. The goal has to be to keep kids safe in the schools and to keep kids in the classroom. And you want to prevent outbreaks in those settings. A lot of people talk about the fact that COVID hasn't been as deadly in children, and thankfully it has not. This would be a whole different ballgame if it was as deadly in kids as it is in older adults. But we don't know the long-term implications of this virus, and you don't want to see this become epidemic in children like it has in many states. I mean, there's states in the South where this has really ripped through schoolhouses, and that's deeply unfortunate because we don't understand what the long-term implications of COVID is going to be in a lot of these kids who've been infected. You
sit on the Pfizer board. We've seen the recommendation, and it is for older Americans and for people who are vulnerable. Of course, this is still going through the process this week with the CDC. The White House got ahead of this process, talking about a rollout for all Americans of a booster shot. Do you think they jumped the gun? Do you think the president jumped the gun?
No, I don't. I think the White House did the right thing. I mean, they didn't have to talk about a specific date. Perhaps that created the perception that they were locking into a date and getting in front of the regulatory process. But I think they were right to talk about an approximate time frame for when they wanted to roll out boosters. Because if you want to make boosters available to an older population, particularly in nursing homes, it takes weeks to get that in place, to get the logistics in place to actually deploy the boosters. And so if they wanted to be ready to start administering them this month or early next month, they needed to have an approximate date. What happened in the Trump administration, and I was talking to the Trump administration over this time period, is after the vaccines got authorized, I think on December 12th, it took about 4 weeks to vaccinate the 1.34 million residents of nursing homes. And this was over a time period when we were losing about 7,000 people a week in nursing homes. We had to wait 4 weeks to get into the nursing homes to start vaccinating because they hadn't planned in advance to go into those facilities. It took a lot of time. You had to get the consents in place, for example, with the patients. A lot of patients, you had to get the consent from their families. So the Biden administration didn't want to make the same mistake. They wanted to have the logistics in place. So I think they've done a good job of that. And so it created a perception that they were getting in front of the regulatory process, but that's not what was going on. They were just trying to get the logistics nailed down so they could be ready to administer these vaccines, and they will be.